Hi there. My name is Genevieve Richardson. I'm the owner and founder of LIFE Speech Pathology and Life Aphasia Academy. I wanted to take this opportunity to share with you a little bit about our approach and what makes this private practice special. So I wanted to focus on how do we measure success? Most clients and families can get therapy anywhere, whether it's the outpatient clinic at the hospital down the street, another private practice, an aphasia standalone clinic. There's lots of options available to you once your loved one is medically stable and is discharged from the inpatient rehabilitation. So let's talk about how do we measure success? I measure it based on my patients saying that they feel like they are connected with their loved ones. They have communication abilities. And keep in mind, communication can be more than just speech and words. It's your whole body language, it's facial expressions, it's gestures, it's writing words, it's pointing to things. So communication is multifaceted. And then finally, we look at quality of life. Are you able to get back to doing the things you want to do? We focus on whole person, whole family aphasia treatment. We follow the life participation approach to aphasia treatment, which is a holistic approach to rehabilitation. We focus on communication abilities and participation in everyday life. My motto is your goals are our goals. Treatment is based on what is important to you. It's not what it's important to me. I can coach you on impairment level treatment if we need to work on words or concentration or reading. That's all impairment level. The bigger picture is we need to look at how are you going to get back to life? How are you going to go back to work, for example? How are you going to resume college classes? How are you going to go to coffee with your two best buddies that you used to see every week? That is life participation. So there's four areas that we focus on with life participation, and it's abbreviated LPAA. Participation in life situations. It's your personality, your attitudes, your feelings, language, speech, and related impairments, and the communication and language environments that you are in. All of that equals living with aphasia. So, we want to use the LPAA method to positively impact how persons with aphasia navigate their environment, life situations, their personal identity, their feelings, in addition to doing direct treatment on their language impairment. So conversations, right? It's how we converse with people and how we connect. So we want to look at what is the communication access? What is health information that needs to be conveyed? Do you understand what aphasia is and all of those implications? And we want to know what are your personally relevant topics. All of this, because we give this personalized approach to treatment, it increases motivation, compliance, satisfaction, adjustment, and decreases anxiety, fear, and confusion. So, what is our goal of goals? You deserve to have a way to communicate. Goals should be relevant and meaningful for the person's environment. Interventions need to meet the person's immediate needs and make a difference in the long run. So, a couple of examples of this communication needs. When you're in the hospital right after a stroke or after a medical condition in which you have aphasia, you need to be able to use the nurse call button. You need to communicate basic needs. You need to be able to understand procedures. You need to make menu choices. All of that can often be taken for granted by the medical professionals that are trying to save your life, trying to save other people's lives, trying to make sure you're medically stable, and communication can fall by the wayside. But you have a right to demand that communication needs are met at all phases of rehabilitation. So once you're in rehab, whether that's inpatient rehab or rehab in a skilled nursing facility, those kinds of things, who do you want to be able to talk to? What do you want to be able to say? Where do you want to tell people you want to go? When do you need to be there? How is it going to happen? In speech pathology, we use a lot of WH questions. You'll hear that quite often from clinicians. But the reason they're so important is because they kind of encapsulate some basic needs. So let's move on to home care. What are some communication needs when you're back at home now, you're medically stable, but maybe it's hard for you to leave the house? You need to be able to communicate your needs to care partners. You need to be able to manage medications. You need to be able to use the telephone or computer, whatever it is you need to be able to do. People want to share their thoughts and feelings. So let's talk about everyday activity success. So on this left-hand side, you'll see family relationships, leisure and recreation, medical care. We as speech pathologists need to help our clients and families get to the point that they are actively participating in their life in these areas. So there is a study by Worrell and colleagues in 2011. I forgot to put that on the slide, but they interviewed 20 participants with aphasia, and they said they want to return to pre-stroke life, communicate opinions, not just wants and needs. They want information about aphasia, stroke, and available services. They want more therapy. They want greater autonomy, dignity, respect, engagement in social, leisure, and work activities, regain their physical health, and they want to be able to help others. So let's talk about some real words from some of our clients that I've worked with and how they define success. Some of this is not the end result of success, but it's part of the process that they have gone through, which ultimately led them to success. In general, they all agree that hope, having the right mindset, setting your intent of what you want to accomplish, plenty of practice, all of that leads to success. So, in their own words, they are learning to focus on the here and now, not the past, not dwelling in the past, and not getting too caught up in the future either. They are learning to live in the present and smell the roses. They are releasing preconceived notion and time constraints. You don't have to go to the gym before 6 o'clock in the morning when you're retired, unless there, I guess, if there is no other time of day. But one of my clients just today talked about he released that preconceived notion. He went back to sleep, he went back to bed, and he got 2 more hours of sleep. That's a win. We want wins. We want sleep. Sleep helps the brain, sleep helps the body recover, whether it's from a stroke or you have an ongoing neurologic condition. Give yourself and give others grace. We get so caught up in this perfectionistic mindset. We don't need to be perfectionists. Good is good enough. Why not let this be easy? Another client said this to me today, and it's a motto I've heard from an entrepreneur that I've been following for quite a while. She says that all the time, and it resonates deeply with me. So, some other forms of success, my clients being able to play games on their iPad with their granddaughter, using their phone to look up and call their friends. They want to be able to text their buddies. They want to communicate to the doctor about their concerns. They want to be able to tell their spouse how they appreciate them. They want to cheer for their grandson at the baseball game. They want to release the hustle attitude and give themselves some self love. So we're going to wrap this up And I just want to say thanks for listening. I hope you have a little bit more understanding about my passion for working with the aphasia population, wherever you are in the rehab system. I am a Medicare Part B provider. I'm in private practice. So the clients that I see can have gone through the hospital, rehabilitation, maybe some home health care. Sometimes they've already gone through outpatient treatment, and then they come to me, even a couple of years after a stroke. I refuse to condone the idea that there is a plateau when we talk about speech and language. There's always another way, there's always another angle. If the clinician that's working with you, even if it's me, even if it's my practice, there is always another way. If you're not willing to settle, you need to seek out the right person for you. I work with clients years and years after a stroke who have dense aphasias. We still make progress in communication. They still make connections with their family. They still have quality of life. Your life matters. Your goals matter. Life Speech Pathology comes to you via Zoom. We Zoom into your house via the computer on a computer, laptop, or a tablet. No iPhones, too small of a screen. But I believe in telepractice in that we can provide specialty services to you, to your loved one. And the beauty of Zoom, I can incorporate all your family and friends no matter where they live. If they've got an internet connection, they can join us on a session. That's where they can get training. That's where they can understand about aphasia. So if all of this or parts of it or little bits of it sound good to you, why not schedule a phone consultation? Let's get on the phone. Let's talk about your goals. Tell me who you are, what you want to be able to do, and where you want to be. Let us help you reach your goals. Our motto is do more, do life. If this message resonates with you, click on the schedule a consultation button below and we'll get started.